Hi, my name is Wendy Steffes. We're going to be doing a pulmonary assessment, lung and thorax, on my patient Ashlyn Verhoff. I chose to do it on Ashlyn today because she actually has scoliosis, so I thought that would kind of put a fun little spin on this, and maybe there may be some differences. So when I am doing a pulmonary assessment, first I would ask Ashlyn as a patient, like, are you having any breathing difficulties today, Ashlyn?
Not any more than normal.
Not anything more than normal. So do you feel like it's hard to breathe then, or?
Well, I know with the spinal fusion, which I've had, does actually impact my breathing.
Okay. So do you find a difference before the spinal fusion and after the spinal fusion then?
I can't take a full breath.
Okay. But before you could?
Yes.
So now you're very limited in your expansion, basically,
yes.
Your full lung expansion. Have you had any recent coughs or any kind of sputum, nothing? Okay. So we're not running into any kind of sicknesses that would deter us or would inhibit any kind of full respiratory function. But you do feel like you just can't expand your lungs completely. So,
correct.
Okay. So when I am doing a full assessment, I'm going to first start with my inspection, and I'm going to do we'll do it anteriorly, so the front of you, and then we'll have you turn around and we'll do it on your posterior thorax as well. Okay, so I'm just gonna look at Ashlyn basically and make sure that she's, equal on both sides, that she doesn't have any kind of disfiguration. Before her spinal fusion, she did have a slight, I think it was like to the right?
So.
And so her thorax was actually turned a little bit to that side, but now since the spinal fusion, she sits up straight. I can see her thorax. Basically, you can lift your arms. And do you mind if I roll this down here? Okay. Bilaterally, it looks normal. I can feel it, and it feels like it is doesn't have any kind of abnormalities to it. So that's just my basic inspection of that. I'm also going to palpate and just kind of feel her chest and feel around her breast and down her thorax to make sure that she doesn't have any masses. And then as I'm doing that, kind of inspect to see if there's any lesions that I can see at all. And I don't see any lesions. I'm not feeling any masses whatsoever. So also when I'm looking at her too, I'm going to look at, like, is she leaning forward to breathe? And is she struggling to breathe? What is her quality of breathing? Is she breathing evenly in and out? Does she have pursed lips or any kind of nasal flaring when she's breathing? And I don't see that she has any of that. I feel like her rate, her rhythm, her depth, and her respirations are equal, and they're not fast at all. So there's nothing abnormal that I'm seeing. I also would want to inspect her face, make sure that everything's looking normal, that her lips aren't blue, she has normal coloring in that, and then do a quick inspection of her fingernails and her fingers to see if there's any kind of abnormality that I see there. But she has normal skin tone coloring, so I don't see any abnormalities with that. When I do palpate, part of my palpation test would be the Firminitis test. And when I do that, I'm going to start above her clavicle here, and I'm just with the side of my hand, I'm going to press in between her rib spaces. And when I do that, Ashlyn, I want you to say 99, okay? So go ahead and start that.
99.
Okay.
99.
Okay.
99.
Okay.
99.
And then I'll go below and just kind of feel in between there. Okay, and again?
99.
Okay, so, and when I do that, I am going to be palpating and feeling vibrations. So when she says 99, I should feel some vibrations to that. And I do. And then you're going to do it again on this side. So we'll start this again on this side. Go ahead.
99.
Okay, and then, okay.
99.
Okay.
99.
Mm-hmm.
99.
All right, and then under your breasts as well.
99.
Okay. If I hit a rib or I go over a rib and she were to say, so let's do that so go ahead and do 99.
99.
When I do that over the rib, I shouldn't feel any vibration at all. So you have to make sure that you're in between the rib spaces so that you feel that vibration. When I'm looking at her anteriorly, I want to reach underneath her thorax here, basically, and then take a nice deep breath in for me, Ashlyn. Okay, and I want to make sure that I'm feeling a normal expansion when she is taking a deep breath in, just to make sure anteriorly that she has equal bilateral normal expansion on both sides. Since we're going to be doing this, I'll also listen to your lungs, okay? And then we'll do what's called percussion on that. So actually, let's do percussion first. So when I do percuss, basically I'm going to be going in between the rib spaces, and when I percuss, I'm just going to hear like resonance sound and then go all the way down until I get like a dole sound, and that will tell me that her lung sounds are nice and clear. If I had any kind of dullness whatsoever, then that would tell me that we might have some kind of abnormality within her lungs. So by percussing that and hearing that resonance, that means that her lungs are nice and clear. You would do that all the way down. All right, let's go ahead and listen. We'll auscultate your lungs. So when I put this on, when I put the diaphragm on your lungs in each space, I want you to take a nice deep breath for me, okay? I'm going to start above her clavicle line, actually, so go ahead and take a nice deep breath. Okay, and out. Go ahead. Okay. Okay. All right. And then, Ashlyn, go ahead. Can you do that one more time? Nice deep breath. Okay, good. So if you have a male or a female that has large breast tissue, at this point when you're listening below their breast, you would want them to lift up on that breast tissue so that you can get full equal breath sounds with that. But Ashlyn doesn't have a lot of breast tissue, and so we don't have to worry about that. But as I listened to her lungs, I went laterally in a lateral pattern, and by doing that, I can notice, or I would notice any kind of differences in each lung side, and everything sounded clear and perfect. So at this point, Ashlyn, I want you to turn around, and we're going to look at your back here. We're looking at your thorax here. Okay, so Ashlyn's back, you could see her scar line from her spinal fusion. Once again, I'm going to be inspecting her back, and so it's nice and straight. It looks equal. Like I said before, there was a slight deviation where her shoulder actually was lifted this way, so her thorax was misshapen, and that caused some difficulty breathing. But like she said too, especially with like sports and such, I know that she had some difficulty catching her breath at times and having full lung expansion. So, and like she said, at this time, because of the spinal fusion, it has inhibited her full lung expansion. So I'm going to be inspecting again, of course, to just make sure that we have equalness, and we have a good shape to our thorax, which we do. I will be palpating as well for any kind of masses or lesions, and posteriorly I don't feel anything. I'm not feeling any masses or lesions, so that's good. Perfect. Okay, and then once again, I will auscultate and listen to that, but what I'm going to do now is I am going to do percussion on her posterior side. So, of course, your scapula right here on both sides, when you percuss, you'll feel, you should have the same resonant sound as you go down. I have a little harder time doing it in the lower areas. But that's where you should feel the dole sound, and you're not really, so you kind of want to go around the scapula here. And getting that resonant sound, and then as I go down lower, then it goes dull. So just going through each intercostal space there. And then when you get lower thorax, you'll reach that diaphragm area where you'll get a dull sound. So moving into that, as we percuss, we can do what's called a diaphragmatic excursion. And I'm just going to pull your little bralette up here. Okay, Ashlyn. So as I percuss and get down, I'm going to have you take, I want you to take a nice deep breath, okay? And I want you to hold your breath. Will you do that for me? Take a nice deep breath. Okay. Okay, so now this is dull area, and I'm going to just take a pen and mark that. Oh, okay. And all right, and then I want you to take a nice deep breath again, Ashlyn, and hold that. Okay, and it's about the same space here. Okay, and then what I want you to do again is take a nice deep breath. Take inhale, and then exhale forcefully, okay? So. Oh, hold on. Let's try that again. Sorry. Take a nice deep breath in and exhale forcefully, okay? We're having a good time doing this.
I
So
can't take a full breath.
That's okay. That's okay. So typically, when you do an excursion, you'll do it on both sides. You go from the resonance to the dullness where your diaphragm is, and then you're going to measure this. They should be equal on both sides and should be between 3 and 5 centimeters. That lets us know that they have good diaphragmatic excursion. Basically, the diaphragm is expanding in the way that it should. So I'm not explaining that well, I'm sorry. But in an athlete, you might have a wider space, but you should be equal on both sides, and they should be between 3 and 5 centimeters as well. Okay, so when you are going to auscultate, you want to do all lobes again on the back. And Ashlyn, at this point, I need you to hold your arms like this so that I can get to the side of your axilla area, okay? And then every time I put this on there, I want you to take a nice deep breath in for me, okay? And then out. Okay. One more on the. And it seems like her lungs are very clear. I can hear breath sounds, but you know, it doesn't seem like she can take a nice deep breath. Okay, nice deep breath again and again. Okay, and out. Okay, and again, nice deep breath. I don't hear any crackles or wheezes, so that's good. But like I said, it does seem like she doesn't get to expand her lungs as much as she should be able to in a normal adult of her age. Okay, and then nice deep breath. And do that one more time, Ashlyn. Okay. And then again on this side, nice deep breath. Okay. And again. Okay. So lung sounds are nice and clear. Next, we would do what's called a bronchophony. I can't even pronounce this. Bronchophony? I know. Your mom, she struggles. She does. I know. When I press this on your back, I want you to say 99, okay? So every time you feel me press it down, say 99, okay?
99.
Okay.
99. 99. 99. 99. 99.
Okay. So I hear sound, but I don't necessarily hear the 99, and that's exactly what you're supposed to hear. Next, you would test it's an E test or an egophony test. And what I want you to do is when I press this to your back, I want you to say E, okay? Okay?
E. 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 E, 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 E.
Okay. And at this point, I do hear the letter E, and that's exactly what I'm supposed to hear. If there was any kind of obstruction or if she had like a pneumonia or such, then I would hear more of an A sound, and I'm not hearing that. The last test we're going to do is what's called a whispered gosh, I am really struggling. Pectiligree? Forget it. Good heavens. I obviously have some serious issues when it comes to dictation. So I will have you whisper 1, 2, 3 when you feel me with the stethoscope, okay?
Just whisper.
All right.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. All right, perfect. And with that test, when she whispers the 1, 2, 3, I should hear a faint or muffled sound, which is what I'm hearing. So that concludes our pulmonary assessment. I apologize that I cannot pronounce these words properly, and but hope that I went over everything clearly and that there was good understanding of what I was trying to convey. So thank you.